room if anyone else joins us. And let's do this. So welcome everyone to the Vagina Dialogues. My name is Shirley Weir. I'm the founder of Menopause Chicks. I think many of you already know me because I host a private online community at menopausechickscommunity.com. It's on Facebook. We have some 43,000 amazing members in that group. I already know from some of the research that we've done that 77% of women have questions about their health. Today, we're going to do a deep dive on questions about vulva and vaginal health. And yeah, I just, again, want to congratulate you and thank you for putting your name at the top of the list, for taking time out of your day today to make sure that you have this important information. I just want to make sure. I think we've got a couple more in the waiting room. Thank you for your patience. Hi, everybody. Welcome to the Vagina Dialogues. We're just going to get started. So, the next masterclass is on August 15th. I'm going to talk about this at the end, but in case you have to go, please mark it on your calendar. You can register at menopause-masterclass.com. This is an all-inclusive, and maybe some of you, I know I recognize a couple of names already, have taken this. This is everything that you need to know about the roles and responsibilities of your hormones. And we go through a hormone pyramid where you can actually start to ask yourself questions about how you want to address your hormone health. I do a complete section on hormone therapy and sleep. And the ultimate goal for me is to prepare you not only for this journey, but also for your next health appointment. So you can feel confident and empowered when you're speaking to your healthcare professionals, either before an appointment or to dissect some of the information that you receive at your appointment so you can decide on next steps. But today, as I mentioned, is all about vulva and vaginal health. And you should know that the medical term for what we're talking about today is actually genitourinary syndrome of menopause. It kind of sounds like fingernails on a blackboard to me. First of all, it gets shortened in the medical community to GSM. Secondly, I don't know any member in our community who has ever gone to their doctor and said, "Hey doc, I think I'm showing signs of GSM." It doesn't happen. And sadly, there are many doctors who wouldn't know what you were talking about if you did say that. And then the third reason I don't use the term GSM is that I don't believe that syndrome and menopause should be in the same sentence. Menopause is one day. It's the 12-month anniversary of your final period. Yes, there are some hormone fluctuations in perimenopause, the phase of life leading up to menopause, and in postmenopause, which I didn't say at the top, but I'm 55 years old. I reached menopause at age 49, so I've been in postmenopause for 6 years, and I will be in postmenopause for the rest of my life. So I prefer to use words that have more meaning and relevance to the women in my community, and that is vulva and vaginal health. Now, we have to start this conversation off by talking about why it's important. And so I use this wheel. It's important so that you can sit comfortably, so that you can move comfortably, so that you can go to yoga and do all of the activities, dancing that you love and feel comfortable doing those activities. It's really important that you feel confident and amazing in your own body. Talking about vulva and vaginal health is equally important because we need to make sure that women are avoiding UTIs, urinary tract infections. It's one of the most common reasons why we visit our doctor and get prescribed antibiotics in postmenopause. And that's because reoccurring UTIs are a big threat to women postmenopause. And taking care of our vaginal health, making sure that our urethra is healthy is one of the ways that we can do that. And we'll talk a bit more about that as we go through. I also want you to avoid incontinence and pelvic organ prolapse. That's when some of our pelvic organs can drop into the vagina. It can happen with our bladder, it can happen with our uterus, it can happen with our rectum. And that is something that if we're prioritizing our vulva and vaginal health, that we can avoid. I want you to be able to wear the clothes that you're comfortable in. And I have a story about that that just like rocked my world. I was interviewing a doctor, and she told me about a patient who had come into her office. This was a couple of summers ago. And her patient said, you know, I'm so glad that it's summertime. And doctor's like, well, yeah, you know, like talk about the weather. She's like, no, you don't understand. I am only comfortable wearing sundresses. I can no longer wear shorts, pants, jeans, because vaginal atrophy is so uncomfortable for me that I'm no longer wearing the clothes that I want to. And that story has stuck with me. I think it's really sad to think that there are women walking around in our community, maybe even folks that we know, that aren't even wearing the clothes that they want to, because of something that is 100% preventable and treatable. And then, of course, I want you to be able to enjoy comfortable penetrative sex if you choose to. Now, there's a couple other things that I'm going to add to this wheel. Can you see that? Or is my head covering it up? Brain health just popped up, and I point to brain health. I point to the word move and connect that with our brain health. So here's the thing I want you to realize is that when a woman is experiencing vaginal dryness, vaginal atrophy, maybe a UTI, just general discomfort with the vulva and vagina, what's the first thing that we tend to do? We stop moving. We stop going to exercise class. Maybe we stop going to our walking club. We make up some excuse for why we can't do our regular activities. And when we stop moving, it significantly impacts our brain health. So that's a really important reason why you're here today and why I'm so grateful that we're having this conversation. The other connection is that UTIs have many symptoms, and sometimes a UTI can even be silent. In older women, symptoms of UTIs, urinary tract infections, can show up and mimic symptoms of dementia. So forgetfulness, confusion. And then what happens is that, and this might, you might know someone that this happened to. It might be something that I want you to leave here today and have a conversation with your mother, your grandmother, the older women in your life. That can send that person on a whole new medical path, testing for dementia. Certainly worry and caregiving responsibilities would apply to that. But ask your doctor, or have them ask their doctor to be tested for a UTI, because we don't want to miss that and then think that it has something to do with brain health. So really important. Incontinence, I throw up the word, oh my God, costly. And the reason, and we're going to actually get into some pad math, is that there are boardrooms right now full of stakeholders who are sitting around waiting for all of us to pee our pants. For 30 to 40 years. They have the spreadsheets. They're calculating how much money they're going to make on disposable incontinence pads. And I'm putting a stake in the ground today, and I know you are too, just by showing up, to say, no, not for me. I'm going to take all of the steps now to make sure that that doesn't happen. Or if it is happening, to seek out the support to reverse it, or to treat it, or to help it not get any worse from this step forward. And that's the thing. Vaginal dryness does not get better with time. And the reason this is an important conversation for us to have today is that there is a lot of nuance in the menopause space and a lot of myths and stereotypes and generational folklore that's been passed down. And one of those stereotypes or myths, if you will, is that menopause is just something we need to get through, that it'll be better on the other side. And in some cases that might be true. Your hot flashes might dissipate. Your sleep might get better with time. That is not certainly a permission slip for you to do nothing and just wait it out, because my goodness, you deserve to feel amazing. But I need you to know and take this message to every woman that you know. Vaginal dryness does not get better with time. If there's a leak in your roof, it will not get better with time. You've got to climb up on the roof and patch it, repair it, get a new roof. And I do not want women thinking, I guess this is just my body now, and it's something that I have to deal with, because it's not. It will not get better with time. And finally, when it comes to vaginal dryness, vaginal atrophy, you also need to know that 80% of women experience this in postmenopause, and less than 4% are currently getting relief or have had a solution presented to them by their health team. Those numbers need to change, and they're changing by you and all of the other members in the Menopause Chicks community paying attention to this subject. So we're going to dive in. Vulva and vaginal dryness. What causes vulva and vaginal dryness? Well, first of all, a decline in hyaluronic acid. So hyaluronic acid is a naturally occurring molecule that our body makes on its own. It helps to keep our eyes and our mouth moist, helps to keep our joints lubricated, and it helps to keep our skin supple the way that we like it. And vulva and vaginas are skin. Hello. The thing with hyaluronic acid, though, is that it starts to decline in our 30s and in our 40s, and then more significantly post-menopause. The second bullet point here is fluctuating hormones in perimenopause. So if you've not reached menopause, which means you have not gone 12 consecutive period-free months yet, you can still experience vulva and vaginal dryness, because hormones in perimenopause, it's the classic definition of perimenopause, are constantly fluctuating, sometimes wildly. And so that can lead to vaginal dryness. The third bullet point is decline in estrogen. So postmenopause is actually defined by a significant decline in estrogen. So fluctuating in perimenopause, reach the menopause point, and then hormones are declining. And estrogen is our juicy hormone. It is also responsible for keeping our eyes moist and our mouth moist and our joints lubricated and our vaginas moist. So when we lose that estrogen, when we're no longer producing it at the same levels as when our cycles were regular, one of the effects is dryness, skin dryness, and vulva and vaginal dryness. The fourth bullet point here for the reasons why you might be experiencing or what causes vaginal dryness is postpartum. And you can already see why that would be, because hormones are fluctuating in postpartum. So if you know anyone who's having a baby or has just had a baby, reach out to them. They may or may not be experiencing this, but they might be, and they'll be really grateful to have this information, especially because it's a relief to actually know that you're not the only one. It's also a relief to know that it can be prevented and treated. Okay, the next reason is a biggie. This was a huge learning for me when I started down my education in vaginal health, and that is the birth control pill. So the birth control pill gives women hormones when they don't need them, except to prevent a pregnancy, which I totally understand and respect. But if the birth control pill is your birth control method of choice, you might be impacting your hormone level, and that might be leading to vaginal dryness. So important to know. And then other reasons why someone might experience vulvar and vaginal dryness include breast cancer treatment, other medications, other health conditions, and another surprise for me. I mean, it's not really a surprise, but it was just learning and awareness. And my daughter actually shed some light on this for me. She's 19 now. Overuse of panty liners or absorbent pads. So if you're somebody who likes to use a paper-based panty liner every day, the absorbent qualities of those products are actually withdrawing the natural moisture from our vulva and our vagina. So something to think about, and maybe to switch to a leak-proof underwear like Knix, or just consider not wearing panty liners every day if you don't need them. Okay, so what we're going to do on the next couple of slides is we're going to talk about prevention, and we're going to talk about treatment. And I've put P and T in brackets so that you can see, because I know we're all at different ages and stages of dryness. So number one on the list for prevention is to have lots of sexual activity and orgasms. That sexual activity provides energy to our pelvic floor, which helps to maintain and produce natural moisture. I am not saying have penetrative sex if it's uncomfortable. If it's already uncomfortable or you're experiencing pain with penetrative sex, do not engage in sexual activity. That's not what I'm saying. But as a prevention strategy, and maybe you've heard the term like use it or lose it, there's some truth to that. And I know myself, like when I was 40, I reached menopause at age 49. 48, 49 was around the time that I was just learning this content. And I really didn't want to experience vaginal dryness. Like if I could prevent it, I would. And so lots of self-pleasure, self-care, and really focusing on sexual activity can make sure that this is part of your prevention strategy. Another important part of a prevention strategy is regular pelvic floor exercise. So if you have been a member of the Menopause Chicks community, you've probably heard me talk about the importance, the critical importance of seeing a pelvic floor physiotherapist, or if you're in the United States, you might call them pelvic floor physical therapists. This needs to be a prevention strategy for everyone with a pelvic floor, and that is everyone. Men have pelvic floors, women have pelvic floors. It is not exclusive to women who have delivered babies. And please don't wait until you have symptoms. My first pelvic floor physiotherapy appointment was in 2019. I went in there because I wanted to do a video for the members of the Menopause Chicks community, and I claimed to be symptom-free, although I did leak a little bit during allergy season when I would have a lot of sneezing, but I really didn't feel like I had any symptoms. And I walked out of that appointment learning that I have a stage 2-3 prolapse, bladder prolapse. So you might not experience symptoms or even be in any discomfort. You still need to see a pelvic floor physiotherapist. They're going to assess. The internal part of the appointment is very, very minuscule compared to the hour-long education, one-on-one education that you will receive from your pelvic floor physiotherapist. But it is both a P and a T. It is a prevention strategy and a treatment strategy. So that's what I mean when I say pelvic floor physiotherapy is for everyone. Go write it down on your to-do list right now. If you haven't already, make an appointment. If you need help finding one, let me know. Third way to prevent and treat vulva and vaginal dryness is with hyaluronic acid. So remember I said that one of the causes of vaginal dryness is a decline in hyaluronic acid that our body used to make on its own. The good news is we can give our body that ingredient back. And so in 2019 as well, with Pure Pharmacy, our community, because of all of our members who spoke up about this issue, created the Menopause Chicks Vaginal Moisturizer. It's hyaluronic acid and a little bit of vitamin E. We'll talk more about that, but that is one of the ways, if you can incorporate moisturizing as part of your regular routine. So, you know, we moisturize our face, we moisturize our elbows and our feet. We need to moisturize the vulva and the vagina as part of our regular routine, away from sexual activity, not because there's any danger or risk associated with that. I always say that just because I want the product to like have optimal opportunity to be absorbed and to really work to give you that natural moisture back. Number 4 is hormone therapy. So I've been using hormone therapy since before I reached menopause. So since age 48. And you might be using hormone therapy systemically. Like this is the estriadol that I apply, you know, either to my forearm or to my thigh. And that can be enough estrogen to keep the vagina healthy. But in some cases, it might not be. And that takes us to bullet point number 5. So localized estrogen therapy, localized means applied vaginally. Localized estrogen therapy is a very common way to treat vulva and vaginal dryness. And the reason that there's only a T in the bracket is because doctors sometimes have a very difficult challenge in prescribing a protocol for something that doesn't exist yet. So if you went to your doctor and you said, I'm not experiencing vaginal dryness, they might have difficulty writing you a prescription for localized estrogen therapy. It's a tough one to wrap my head around because you don't want to wait for a grape to become a raisin, because it is a little bit more difficult, not impossible, but it's a little bit more difficult to turn a raisin back into a grape than it is to prevent a grape from turning into a raisin. Is everyone with me on that analogy? So I want you to be preventative, but if you are experiencing vaginal dryness, know that both hyaluronic acid and localized estrogen therapy are ways in which you can treat your current situation, and then you can get back to that wheel of doing all of the things in your life, sitting comfortably, moving comfortably, enjoying penetrative sex comfortably. Really, really important. And I'm talking about estrogen today, but by September, so just a month or so away, we're also going to be talking about DHEA, which is another way to treat vaginal dryness. And I can't wait to bring that. You know, this information is constantly being updated, and the more research that we have, the more information and content that we can share with you, the more options you have. And that's my goal, is I want to present everyone with a menu of options that you have for preventing and treating. Number 6 is red light therapy at home. So this is also a treatment option, but it could be a preventative option for you too. I guess you decide. So this in my hand is called the V-Sculpt. V-Sculpt, and it is a product created by Joylux. So joylux.com. I think they have different names, whether you're in the US or in Canada, but if you see right here, mine's not charged right now, so I don't have it turned on, but this is red light therapy, and red light therapy is effective at restoring the collagen in the skin that lines the vaginal wall. And I know a lot of women who use this. I know pelvic floor gurus who really swear by this product's effectiveness. It's about I think it's like $450, $500, but it actually is less expensive than number 7, which is also an effective therapy that some women absolutely do need to consider. I know a lot of breast cancer patients have used laser by a physician. So there are many doctors and gynecologists who have the equipment and the training and education for laser therapy in the vagina to restore natural moisture. The most common brand name is probably Mona Lisa Touch. And that is something like, I really, with this menu of options, want to emphasize that giving up is not on the menu. So I've tried to put these maybe in chronological order. It's up to you whether you jump around or not, but giving up and throwing in the towel is not an option. So this is the menu that I wanted to share with you. I also want to just remind you how important it is to see a pelvic floor physiotherapist. I recorded my first appointment. Don't worry, it's not X-rated. It's just the conversation and all of the learning that I had with my pelvic floor physio, and you can watch that on my YouTube channel. I also highly recommend that you download Kim Bottomy's app. It's called the Buff Muff app. And Kim, as many of you know, is the vagina coach. Her exercises in this app, the videos, the quality, second to none. The other thing that's really great about Kim's app is that I do want you to see a pelvic floor physiotherapist and get a customized exercise program. But the reason I love the app is that you're going to get the reminder. So if this is brand new to you, you're going to get the reminder so that you can carve out the 10 minutes a day. That's all it takes, 10 minutes a day to go and do the pelvic floor exercises in Kim's app. And you will definitely notice a change. And then of course, she's very supportive in answering questions inside the app too. So the link for that is there. I want to switch gears for just a second and talk about a common question that I get about moisturizers versus lubricants. And I know that sometimes this moisturizer, we're a Facebook community. Sometimes people get confused as to whether or not they should be using it as a lubricant. So the answer is moisturizers versus lubricants. Yes, I want you to use both. Moisturizers are an investment, like moisturizing your skin. It's an investment. It's a long-term strategy for you to keep the skin of the vulva and the vagina healthy. Lubricants are a one-time use. They're for in the moment, they're for pleasure and fun, and their job is to reduce friction. There is no long-term benefit to using a lubricant if you are trying to invest or address vulva and vaginal dryness. You have to use a moisturizer for that, but for sexual activity, for pleasure and fun, use a pH balanced lubricant. And yes, that's the answer, both. This is a conversation that I was really hoping we could address today, because I do get a lot of questions about, what do I buy? And so I went to my local drugstore and took a picture of that aisle. You all know the aisle that I'm talking about, just to demonstrate how confusing and overwhelming it can be in a retail environment to know, is this a moisturizer? Is it a lubricant? What if the package says it's both? How does that work? Do I use it for sexual activity? Don't I? A couple of tips that I want to leave you with today. One is, I want you to turn the package around. No matter what it says on the front, no matter what the marketer or the copywriter was able to catch your eye with, please turn the package around and read the ingredient list. This is really, really important. First of all, you know now the difference between a moisturizer and a lubricant. Secondly, when you look at the ingredient list, just like food products, they have to be listed in the order of the quantity that's inside. So they don't have to tell you how much, but they do have to list it in order. So if water is the first ingredient, that means that it is predominantly water, or water is the largest component of the ingredient list. Aqua is another name for water. So this product has water and aqua. Glycerin, any word that you can't pronounce. And I want you to watch for wax. Wax is something that we took into careful consideration when formulating the Menopause Chicks vaginal moisturizer, because any product that's housed in wax, like a capsule that you are to insert, it is supposed to melt upon body heat. But what the pharmacists found with the doctors that they work with is that a lot of the times, not all of that wax melts. And then women experience discharge, and large, clumpy discharge, white discharge sometimes, get very alarmed, go to their physician. The physician doesn't know what it is. It's not, they've tested, it's not yeast. Call the pharmacist, and the pharmacist is like, yeah, it might be unmelted wax from the product that you're using. So we don't use wax in this product, but it's just something for you to consider that I had not thought of. So I thought that I would pass that along. And this screen, I really wanted to share with you today. It's from May 2021, but just a little over a year ago, the International Society of Gynecology posted this webinar for all of their members. So this is the International Society of Gynecologists saying to all doctors, all physicians, all gynecologists, that the first line of treatment for vaginal dryness ought to be a moisturizer. And one of the presenters here is Dr. Petra Stute, and she's a gynecologist in Europe, and it's her and her team who actually did the study in 2013 that found that hyaluronic acid was as effective, so equal to localized estrogen therapy for the prevention and treatment of vaginal dryness. So that's really exciting that all of this information is now getting out to women, to our members, and that we have this opportunity to close the gap between that 80% of women who currently experience vaginal dryness and less than 4% getting treatment. So every day I feel like we're closing the gap on that. I just wanted to share that with you for your information, but also for your doctor's information. So if they need the link, if your doctor needs the link to watch this, I am happy to provide that for you. These are some of the reviews from the vaginal moisturizer. I need to update them, but some of them are just like, this woman said she literally had tears with how well it worked and gave her quality of health back. But I have tears as well when I read your reviews. So thank you for all of your feedback. I probably need to update this one too, but one of the reasons why I like this is because pelvic floor physiotherapists are now recommending the Menopause Chicks vaginal moisturizer to their clients. And because they see their clients, on a semi-regular basis, they're actually seeing the results as well. So that's really, really exciting. And while we're under the topic of moisturizers and lubricants, I want to share just another little tidbit of information that kind of blew me away when I first heard about it. But if you're choosing a lubricant, I need you to make sure that you're choosing one that's pH balanced. And the two biggest culprits in producing lubricants and putting them on that drugstore shelf that I just showed you are products, manufacturers, and brands that promise warming. So stay away from anything that says it's going to give you a tingling sensation, or is made with peppermint, or is going to warm up the genital area. You do not want any of that, because those products have generally a higher pH level and higher osmolality. And you want to make sure that you're using something that's close to the natural pH level of the vagina, which is, somewhere in the neighborhood of 4.5 to 5.5. Now, the pH of our vagina changes. It can change with bleeding, menstruation. It can change with hormone fluctuations. It can change with sperm. It can change with products. If you're using any products, please don't. Don't use any soaps or washes. The vagina is a self-cleaning oven. But those would be examples of things that can change the pH level of the vagina. What's important when we're addressing vaginal health is how quickly the pH goes back into, the vagina goes back into its natural pH balanced state. And so I use this product from Good Clean Love. It's called Almost Naked. And it is something that you can get when you order the vaginal moisturizer from Pure Pharmacy. The second product that, the second category of products that can be a big culprit in producing lubricants that are not close to our natural pH balance are the ones with the big marketing budgets. And that was really kind of sad for me to hear, because I think, the more we hear about a brand, see ads in magazines, what have you, the more trust is built up. We think, oh, they know what they're talking about. The reality is that manufacturers of lubricants do not need to post their pH level or their osmolality level on the packaging. So you have to either know this information, you have to try to find the information on their website, which I have tried on many websites and can't really get to an answer, except Good Clean Love. So you can find the pH level of all their products on their website. So hopefully that's the shortest distance between 2 points for you. And now we need to touch base on incontinence. And remember the wheel, I was saying why this is so important. Lots of women will say to me, I'm not sexually active, so why would I need to prioritize my vaginal health? Well, this is one of many reasons. Preventing incontinence, protecting your brain health. I mean, there's so many reasons why vaginal health is linked to other areas of health in addition to sexual health. Right now, the projection is that by 2025, which is right around the corner, incontinence pads will make up $16 billion US. That's how large the category is expected to be in a couple of years. 58% of nursing home residents will use paper-based disposable incontinence pads, more females than males. The rough calculation is that that's about $1,300 per year per individual. And so if you don't do anything about incontinence by prioritizing this area of your health and by seeing a pelvic floor physiotherapist, you are probably looking at $52,000 in the next 40 years. So if anything, with this free member event, if I've saved you $52,000, then hopefully it's been worth your time. UTIs, another area of education that I've really invested in the last year. And what I'm going to do, just to make sure that we've got time for Q&A and to not take up too much more of your time today, is when I send you the replay of this workshop tomorrow, I'm going to include a link to a workshop that I did with a urologist in May 2022, Dr. Colleen McDermott, and she talks about UTI prevention. So I've got a couple of slides on this, but hopefully you will watch the webinar with Dr. Colleen McDermott and share it with all of the women, especially the older women in your lives, because UTIs account for 8 million doctor visits per year. And the majority of those doctor visits result in antibiotics, and we can't keep that cycle going. We've got to, again, put our stake in the ground and say, how can we prevent these UTIs from happening? So one of the ways for prevention is cranberries. Yes, that's what I'm saying. Cranberries, yes, but it has to be such a highly concentrated form of cranberry. So, I mean, none of us are drinking 32 ounces of pure cranberry juice per day. And a lot of the products on the shelf will say, you know, cranberry included, but don't have the concentration of packs that Utiva has. So this is the product that Dr. McDermott recommends. She also recommends localized estrogen therapy. And the reason for that is that in postmenopause, with vaginal dryness, the urethra gets shorter and smaller and more susceptible to infection, to this bacteria that leads to a urinary tract infection. So by using localized estrogen therapy, we're keeping the urethra healthy, and that is really important. So I want you to watch the Say Goodbye to UTIs and look at Utiva Health as well. This is a quote from Dr. McDermott, who recommends the Utiva PAX product, as well as speaking to your physician about localized estrogen therapy. If you need any help in forming or preparing that conversation with your doctor, that's what I'm here for. I love to do script tips and send you to your appointment as informed as you possibly can be. So that's something we can either do in the Q&A or we can talk about offline. And that we're really, really close to the Q&A right now. These are the links I want you to check out. Moisturizeyourvagina.com takes you directly to the moisturizer, or if you're interested in some of the other products that I mentioned, the Utiva or the Good Clean Love lubricant, go to purepharmacy.com/menopause chicks. And I want to give you a couple of bonuses. You can either use MChicks13, which is $13 off if you're ordering $100 or more, or at any time you can use MChicks10, which is 10% off your order. And if you write those codes down right now, or just watch the replay tomorrow. That's an example of what you'll find at purepharmacy.com/menopause chicks. This is a review slide. I really want you to feel amazing. I'm so grateful that you took time today to join me for this important conversation. And I am going to jump in to our questions. These might be some of the questions that you have. I'll leave that up there for a second while I open up the chat. And don't forget, if you haven't already, register for menopausemasterclass.com for August 15th. Okay, so I'm going to stop sharing and see what you've all been saying in the chat. We've got about 15 minutes, but I'm going to stay until all your questions are answered. So if you have to drop off, as I mentioned, just open up the replay tomorrow, fast forward to the Q&A. And does anybody have any questions on what I was talking about? Is anybody still here? I know it's a hot one. It's a hot one on the West Coast today anyway. What's the link to the masterclass? Beth, the link to the masterclass is menopause-masterclass.com. I'm just going to pop it in here for everyone. So this is an all-encompassing masterclass on hormone health. And I will go through all the definitions. We address some of the myths and misconceptions. You will leave the class knowing the roles and responsibilities of each hormone and some of the common experiences to expect when you're navigating perimenopause to menopause to postmenopause. So it's really important. Not a question, but I wanted to say that the hyaluronic acid and the Utiva products have made a huge improvement in my life. Hey, thanks so much for that testimonial. You know how to make a girl's day. You know, I work with so many people, but I also work alone a lot in my office today, the fan going. And so just hearing your feedback like that and the impact that it's having to your quality of life means a lot to me. And I hope it means a lot to you that you have solutions so that you can now go out into the world and feel amazing. So thank you for being an amazing role model. For healthy women in postmenopause, how safe is it to use Vagifem? Okay, so great question. It was prescribed to me, but gave me a bad breast pain and soreness. So it does go through my bloodstream. Is that safe? So generally speaking, Vagifem is a brand name, by the way, everybody. It's a brand name for a pharmaceutical product, an example of localized or vaginal estrogen therapy. And estrogen therapy is very complex. If you haven't done the masterclass yet, we'll talk about all of the complexities and questions you need to be asking. If you are having an adverse reaction to any prescription product that you're taking, don't self-diagnose, don't quit or adjust the dose on your own. Please return to your prescribing physician and discuss that experience. It might be the wrong hormone for you at this age and stage. It might be the wrong dose, or it might be the wrong mode of delivery. So mode of delivery can be oral, transdermal through the skin via a cream or a patch. It can also be vaginal via a cream or a ring or a suppository. And there are other ways to deliver hormones to our body as well. But, you know, I'm so sorry that you had an adverse reaction. And I really, really want you to get as curious as you possibly can to make sure that your vaginal health is being addressed, because that's the most important part. The ways in which we do that are going to be different for everyone. Yes, vaginal therapy, vaginal estrogen therapy is earmarked as safe for women to use. A little bit of it does enter the bloodstream. It doesn't pass through the liver, so it's not like an oral medication. And it is also regarded by the North American Menopause Society as one of the safest ways to treat vaginal dryness. But you saw my slide just a couple of minutes ago from the International Society of Gynecologists, and they are saying that the first line of treatment that physicians should be considering with their patients is moisturizing with a hormone-free moisturizer, which would be an example of that would be the hyaluronic acid product. It's hormone-free. It's not a prescription. So while there's a recommended dosing protocol, many members, use it 3-4 times a day to start, knowing that they can taper back once their dryness improves. I hope that answered your question. I can't say that it's safe because the answer is it's individual. And it really requires having an expert hormone expert on your team who can go through sort of all of the questions on what is going to be right for you. And if you need screenshots of some of these slides for the options that you should want to try, or you want to message me privately via Facebook Messenger, please do. We'll work through it and we'll find a solution that's right for you. Okay, hi Shirley, what about fecal incontinence? Can that be improved by estrogen therapy and all the other products you suggested? So I don't know the answer to that. The first thing that you need to do is to work with a pelvic floor physiotherapist. I hope that you are already. I think that, using estrogen therapy is one of the ways to keep the vagina healthy, and keeping the vagina healthy helps to keep the pelvic floor healthy, but it's a Rubik's Cube, right? So there isn't one magic wand. There isn't like, oh, if I just use estrogen therapy, all will be well. No, you actually have to consider pelvic floor exercise, pelvic floor physiotherapy, moisturizing with hyaluronic acid, having a conversation with your doctor about the benefits of hormone therapy for you. And maybe if those things aren't working, you might have another conversation with your physician about surgery. Kim Botany, the vagina coach, she documented her surgery because she had a rectocele. And that's when the rectum bulges into the vagina. And, you know, as a vagina coach and being such a advocate for preventative strategies, she still chose surgery for herself. And so that's, you know, nothing like suffering is not on the menu, but there are all of these options available on the menu for you in order to address what you're currently dealing with and to feel amazing. I can't attend, so I register and watch the recording later. Yes, absolutely. I have been hosting the Menopause Masterclass once a month, and I've been hosting the Vagina Dialogues on the last Thursday of every month. And all of our workshops are recorded and sent out 24 hours later. And it comes with an invitation for you to watch, rewatch, share with your friends, share with your doctor, and if you have any questions, to contact me. So that's what's included. If you can make the live, great, because it really helps to shape the content, knowing what questions you, the registrants, have. But if you can't make the live, you can always watch the recording. I don't experience vaginal dryness, but I do experience pain during intercourse. Will estrogen therapy help with this? So the first question that needs to be addressed is, why are you experiencing pain and what type of pain is it? And in my opinion, the best professional to help you with that is a pelvic floor physiotherapist. They're going to assess if you're not experiencing dryness. That's fine, but I'm not sure that anybody could say estrogen therapy would be the magic wand solution to that. We have to find and treat the root cause. So pain, I'm not saying this is for you, but some of the root causes of pain can be trauma, can be like physical structure, so something with the lower back or the pelvis, either a muscular or bone structure, or it might be something with the tissues of the vagina that you would want to get a personalized consult from your pelvic floor physiotherapist, who is then going to tell you what some of your treatment options are. Maybe it's moisturizing with hyaluronic acid. Maybe it's an exercise protocol customized for you. Maybe it's estrogen therapy, but I couldn't make that jump for you with that amount of limited information. Who should we see to check hormone levels? For women who have had breast cancer, is there anything else they can take other than the Mona Lisa touch or red light therapy? So checking hormone levels is not always necessary. What you really need to see is someone who is educated, experienced, and an expert in women's midlife hormone health. There is no one designation to guarantee that you have that expertise, so you have to ask. You have to interview your healthcare provider. It might be your family doctor, it might be a gynecologist, it might be a naturopath, but they might also specialize in other things. And if they haven't taken any continuing education in hormone health, you don't really know. I talk a lot about that in the Menopause Masterclass. And the answer to your question about are these your only options, the red light therapy and Mona Lisa touch laser therapy? No, absolutely not. It's a very individualized answer to vaginal dryness, but I can tell you, I know lots of breast cancer survivors who are currently moisturizing with the hyaluronic acid, who are using localized estrogen therapy. Yes, absolutely. I know breast cancer survivors who are using hormone therapy, but that doesn't mean that applies as a blanket statement to all breast cancer survivors. It just means that you have the opportunity to not rule out any of the options on the menu. Go through them one by one and figure out with your health team what is going to be right for you. And the only thing that's not on that menu is suffering, because you deserve to feel amazing. You've already been through enough. And I fear that there's so much fear and rightfully so, embedded in a breast cancer diagnosis or even a recovery or even a family member having breast cancer. And that doesn't mean you're going to get breast cancer. It just means that you've got to talk this through. And please don't make any assumptions about your healthcare based on headlines or hearsay. Take the list of questions. If you want my support in creating that list of questions, I will prepare you for your appointment and give you script tips so that you can go through and find out what is going to be best for your vulva and vaginal health going forward. Hi, Shirley, love your classes. I've started on Premarin a few weeks ago, and I wonder about when it is safe to have oral sex after application the next day. Thank you. Okay, so Premarin is a non-bioidentical form of hormone therapy. It doesn't mean that it's bad. It means that I would prefer that you were using a bioidentical form, and there are many available, and they're all available at any local pharmacy, and any doctor can write a prescription for bioidentical hormone therapy, vaginal hormone therapy. The example that was given just a couple of comments ago, Vagifem, is an example of bioidentical vaginal estrogen therapy. So consider having a conversation with your healthcare provider about switching from Premarin to Imvexxy. That's another brand name, Imvexxy or Vagifem, so that you're getting bioidentical estrogen. And then your question about oral sex. So anything that we are using as an investment product, so that's everything other than lubricants. Lubricants provide barrier to friction. Everything else that's an investment, I would say apply away from sexual activity. And that means probably, like, I don't know this for sure, so this is a non-educated answer, but probably 8 hours. The example I probably use the most is, moisturize your vagina or apply your vaginal estrogen therapy in the morning, like after you get out of the shower, after you brush your teeth, after you've had morning sex. And then by nighttime, like that's going to be definitely 100% absorbed into your skin and safe for sexual activity of any kind. Thank you, Shirley. Good to see you on here, Jolene. Okay, next question. I started about 2 weeks ago with the moisturizer you recommended from Pure Pharmacy. How long on average should it be used until I see if it is working? The answer to that question is very individual because we are all at different ages and stages of dryness. So a couple of examples. If you are 48 and you're in your maybe final year of perimenopause, maybe you've gone 8 or 9 or 10 months without a period and you don't quite know if this is going to be your menopause anniversary coming up, your level of hyaluronic acid in your body and your level of estrogen is going to be different than another member who might be 65 and her hyaluronic acid started declining in her 30s and 40s. And her estrogen started, let's say she reached menopause at age 52, she hasn't been producing that same level of estrogen for 13 years. So I can't answer the question of how long it takes, but what I can tell you, and thank you for using the hyaluronic acid moisturizer from Pure Pharmacy, it has a recommended dosing protocol on the package. And a lot of us really want to be diligent and take that seriously, right? And so, plus we also want the product to, be effective for us. So we follow the instructions religiously. But the truth is, when you get your moisturizer and you're currently experiencing dryness, it is okay to use it liberally. So imagine if you had really dry, I probably do, if you had really dry elbows, you would notice them, then you'd grab your, your moisturizer and you'd apply it, 3-4 times a day. And then your elbows would feel better. And then you'd be like, I never want to deal with that again. So you'd apply it once a day. So I want you to do exactly the same thing with your vulva and vagina. If you're experiencing dryness, Order the hyaluronic acid moisturizer, use it 2 times, 3 times, 4 times a day to start. Notice what that hyaluronic acid can do for you. Hyaluronic acid can carry 1,000 times its weight, 1,000 times its weight in moisturizer. So it is super strong, and it's restoring natural moisture back into the cells of the vulva and the vaginal wall. So you're using 2 to 3 times a day, but you know that once dryness improves, you'll go back to once a day. And for some of our members, even every other day is adequate and fine. If you go to moisturizeyourvagina.com, which is where you order the product, and click on reviews, you can read some of the reviews from your fellow members from the Menopause Chicks community. So I know that you're probably expecting a very straightforward answer, and there isn't one, because we're all different and unique. What are the symptoms of vaginal dryness? I don't think I've noticed anything. It could be happening, and I thought it was related to something else. My incontinence. My doctor mentioned it. Oh, good. My doctor mentioned it at my appointment, but it was quick because we were talking about so many other things, and I didn't get to go back and ask more about it. So, great question. So glad your doctor brought it up. Vaginal dryness is skin dryness, like it's dry skin. The vulva and the vagina are skin. And when that skin doesn't have the same hyaluronic acid or estrogen that it once had, it is going to be drier. Dry skin can become cracked over time. The other thing is that the vagina is a muscle, and muscles can atrophy. Atrophy means getting smaller or shrinking in size. So just like your bicep, if you don't use it, it's going to get smaller and shrink in size. The same thing can happen to the vagina. We don't want you to get to that stage. It sounds like you might not be at that stage yet, but if I knew how old you were and when your last period was, I might be able to have a guess at where you might be in the dryness scale. You just know, when you have dry skin on your face, when you have dry skin on your heels or on your elbows, and you will know when you have dry skin on the vulva. Often the vulva will be affected first, depending on your lifestyle, depending on the type of, if you're overusing panty liners, that kind of thing. And it could be all of the other reasons that we talked about too, like maybe you're on the birth control pill and you're noticing changes to your vaginal health too. So, I feel like that was a very wishy-washy answer, but I'm glad that you asked it, because it's not the first time that I've been asked, how do you tell if you have vaginal dryness? And the answer is like, you'll know, or your doctor might help you sort that out as well. Thank you, Shirley. I really appreciate your help. I will definitely take you up on that. I'll message you via Facebook. That's awesome. I'm 58 and my last period was March 2020. Yeah, so I would say it's been 2 years without estrogen. And I forget exactly what we were talking about. Oh yeah. How do you know if you're experiencing vaginal dryness? I think you're standing at this incredible window of opportunity to invest in the health of your vulva and vagina. And I know that you're on that same page because you signed up for this workshop. So I'm glad you're here. I'm glad you asked the question. I would definitely be moisturizing, if nothing else, but please go see a pelvic floor physiotherapist too. Moisturize as a strategy to prevent it. And then hopefully you never know what vaginal dryness feels like. You're welcome. You're welcome. You're welcome. Thanks, everyone. I know we're like 6 minutes over. I hope you're having a great summer and have a great long weekend ahead of you. It's a long weekend in Canada. And I will see you in the Menopause Chicks community. Thanks for tuning in. Have a great day.